everyone, Prof G here again, and we're going to talk today about the past medical history. So this video series, I'm going to start with the HPI, which I hope you've already seen before you came to watch this video. And this is the second part of a series of videos that I'm putting together about taking a complete patient history. So in this video, we will talk about the past medical history and some of the important tips and tricks to getting a complete past medical history. So let's go ahead and look at our cheat sheet. Here we go. So the past medical history comes right after the history of present illness, which we just talked about in our last video. The past medical history is intended to gather a more complete knowledge of the patient's past, what illnesses they may have had, what medications, surgeries, hospitalizations, and it is a very important part of the medical history. Not quite as important as the HPI, in my opinion, but you could miss some potentially very big things if you don't get a good past medical history. Now, in a lot of the more up-to-date EMR systems, the patient actually gets like an email or a text message ahead of their appointment where they fill in a lot of this past medical history, family history, and review of systems. So depending how efficient your EMR system is, or electronic medical records, you might actually have this information in front of you before you go and speak to the patient. Nowadays, in our clinics, we have like 15-minute patient appointment slots. So we just do not have time to gather this complete medical history in that short of period of time. For that reason, a lot of this information is gathered ahead of time. However, for our practical purposes, we do need to be able to do this and do it well. So let's get started. Let's look at the cheat sheet. So you've just gathered the HPI. Now we're going to move. We need a transition statement. A transition statement takes us from one part of the history to the next, and they're very important to help the flow of the encounter. So you can use whatever you want. This is just kind of an example. Okay, I think I understand about what's going on at present. Now I'd like to ask you a few questions about any serious illnesses or medical problems you've had in the past. Okay. If you really want to get started with the patient, you could talk in a very open-ended question. How has your health been in the past? However, I find, coming from a setting where I am very crunched for time, a question like this can open a can of worms. So be very, very careful and know your audience. Okay. Like I mentioned before, you definitely want to obtain any old records. You want to look through their file before you walk in the room, so you're familiar with them and how many times they've been to your clinic, or how many times they've been to the emergency room if it's an emergency setting. Be sure to clarify the facts. So if a patient is unsure, like say, oh, I had some sort of surgery, I don't know, go back and look at their medical record if you haven't already, and see if maybe you can kind of connect the gaps that they don't know. Because some patients don't know a whole lot, or they can't remember. So just help them out in that way. So there are not that many mnemonics out there for past medical history, but one that I found was A history. A history is a mnemonic for the past medical history, and I actually put that down here in the cheat sheet. So A history in the traditional sense is allergies, alternative medicine. H is for hospitalizations, I is for illnesses and immunizations, S is for surgeries, T is for trauma and travel, O, oral medications, over the counter medications, R, reproductive history or complications, and Y is youth illnesses or yearly exams or screenings. Now, I think it's good. I think you could go with A history and be fine. But there's an order that I like to follow when I'm asking my patients that seems to help things flow better. That's why I've kind of adapted this mnemonic to be my own. So that's what I'm going to go through with y'all. Like I said, you can choose whatever you want, but whatever you choose, stick with it while you're learning and practicing. So I chose to do a medical history. And I know it doesn't include all of the EDICAL. It's just the letters in red. So, you're going to write something down on your cheat sheet before you walk into the encounter. You can write down whatever letters you want to kind of remind you of the different components of the past medical history. So the first thing I like to ask about, so I don't forget, is allergies. Now, this is typically allergies to medications, okay? But you can ask in general, do you have any allergies? And they might be like, you have seasonal allergies. Well, in this context, we're mostly talking about allergies to medications. So I like to be really specific. Do you have any allergies to medications? And if they say no, great. If they say yes, then you need to ask, what was the causative agent? So what medication provoked that reaction? Okay, penicillin, they might say. Okay, well, what kind of reaction did you have? Um, Okay, well, I had hives. Okay, did you have any history of anaphylaxis? No. So then you document all of that penicillin and a hives reaction. Okay. Um, Moving down. So in a history, the next one would be hospitalizations, but I feel like that's a little less important than understanding the patient's illnesses and medications. So that's the second thing that I like to ask. Do you have any medical problems? They can be current or past. Okay. So I don't like to ask serious medical problems, recent medical problems. I just like to ask, do you have any medical problems? If they're like, I don't know, you can give them some examples. Do you have any high blood pressure, diabetes, high cholesterol, asthma, things like that? So that they can, oh, okay, that's what you're asking, and then go through it that way. Now, sometimes, and it's not very common, but sometimes, and I see it mostly in elderly patients, they will literally present to your clinic or your ER with an HEB bag full of their medications. And they're like, here, I don't know what I have. I don't know what all these are for. And then it's a fun little sesh looking through all the meds and trying to sort out what it is that they have and what kind of medications they're taking. Hopefully that doesn't happen to you, but I guarantee it might at one point. Just be patient and do a good job at making sure you have a good complete history. Um, all right. So the second thing, like I said, is illnesses. Do you have any medical problems? If they say yes, like let's say they say I have high blood pressure, you might then ask, how long have you, or when were you diagnosed? How long have you had it? Are you on any medications for this? Which kind of leads into the next one. That's why I like these two back to back. All right. And are you well controlled? How do you monitor it? Right. Okay. So that's what I would do. And then once you're done with the high blood pressure, do you have any other medical problems? And you're going to ask this over and over until they say, no, that's it. Okay. Moving on to medications. So medications can be prescribed medications, over the counter, or any alternative medications. So prescription medications, you want to make sure you have a good list of the medications. A lot of times your medical assistant or maybe your nurse has already established this with the patient. So if you have a list of their current medications in front of you, just go over it with them, make sure that they're not missing anything and that you have the correct medications and doses. If there's not a pre-populated medication list, you need to get one. So you want to have them tell you what medication they're on, what dose they're taking, how often, what is it treating, why are they taking it, do they take it regularly? So that would be compliance, and then at that point, sometime in the visit, you might need to ask them if they need any refills on the medication. Over-the-counter medications, usually over-the-counter medications are taken kind of sporadically or periodically. Like let's say if they're here for a cold, they might be on a cold medication or ibuprofen, Tylenol for fever. So a lot of times we'll get some of the OTC medication up in the HPI, but it's still good to ask, do you take any over-the-counter medications? And the same thing, medications, what dosages they're on, what are they treating? Have they had any side effects? Is it effective? You can also include in here things like supplements, vitamins, things like that. Alternative medication is, you can ask them about it. I don't always ask about alternative medicine, but just know that it exists out there. There's things like acupuncture. I put in here curandera. Those are like the Mexican quote unquote witch doctors, but don't think of it in a negative light. A lot of times patients really believe in these things. So just ask about it. And what I've learned in my almost 20 years of dealing with patients is that you will never try to convince a patient that whatever they believe in is not true. So if it's not harming them, don't waste your energy trying to tell them that going outside with wet hair is not going to give them a cold, or that going to see whatever herbal medicine or specialist that they see is not helping them. Okay. You can kind of try to educate them, but I'm just saying it's really hard to convince someone that something they believe in is not true. So pick your battles, is what I'm trying to say, if it's not hurting the patient. Let's see, chiropractors are also kind of in this alternative medicine scope or spectrum. The reason why I had these little arrows here is because in a medical history, the M comes before the H and the I, actually. But I always like to ask medical illnesses second. Okay, so use the mnemonic to help keep like places for what you ask, but I would ask this out of order of what the mnemonic shows. That's my opinion. Okay. Once you get the medications down and the illnesses, it's time to move on to some of the more, it's more remote, the medical history. So hospitalizations, have they ever been hospitalized? They might say, the only time I've been in the hospital is when I had my babies. The only time I had this was this, So just, take it down. The only time I ever was hospitalized when I had my appendix out when I was 5 years old. Okay. So you just want to document like what they were in the hospital for, why, what the dates, and they don't have to be like, oh, October 2nd, it can be anything. It can be just like when I was 5 years old. So that's around, 1989 or whatever. I'm old, I know. So anyways, you want to document that. As far as surgeries, you want to list them and you want to try to figure out where approximately it was in their lifespan, whether it was an inpatient or outpatient procedure, and potentially any complications that arose from the surgeries. Trauma. So trauma and travel are the two T's. So trauma is, yeah, if you stubbed your toe, putting up Christmas decorations, I don't think I would count that. Sometimes patients have a hard time, like, what are you asking when you ask, have you had any trauma? And so I like to ask, any serious trauma that caused hospitalization or that you sought medical attention for. And that could be like broken bones, serious injuries, falls, accidents. And that's how I like to phrase that. Travel. Travel is important in a lot of different chief complaints. I can think of most recently, like COVID, right? We wanted to know if they were recently out of the country, tuberculosis. Also, long periods of travel can put patients at risk for being static, right? Sitting in the same place for a long time. So that can induce things like pulmonary embolisms or DVT. So that's another reason why we ask. Also, like GI bugs, you can get a little bacterial infection from traveling to foreign countries and eating their food. So those are just some ideas of why we ask travel. And I ask it kind of frequently, believe it or not. Next is reproductive history. So in the past medical history, we have reproductive history. In the social history, we have sexual history. And sometimes those can kind of overlap a little bit. I mean, they kind of lead from one to the other. So you can put them together if you'd like, either here in the in the past medical history, or in the social history, or you can keep them separated. It's really up to you and your preference and what you practice and how the flow goes for you. I'm only going to talk about reproductive history here. So reproductive history is, for females, I think we recognize it a little more. It's mostly, how many times have you been pregnant? And I like to ask it like that, right? I want to ask, how many kids do you have first? Because if you ask how many kids they have and they've had miscarriages, then they have more pregnancies than kids, and you have to kind of backtrack. So I like to ask them, have you ever been pregnant before? And they might say yes. Okay, how many pregnancies? There's your G, your gravida. How many pregnancies? Okay, your para. How many living children do you have? And from there, you can decipher. If they have a gravida 4 but a para 2, you'll know, okay, something's off there. So you can ask a little bit more about that. You can ask them, what happened with the other 2 pregnancies? They might say they had miscarriage or whatever. Just make sure that you're empathetic within that conversation as well. And before you start talking about this, I mean, to me, as if you make it matter of fact, it's not awkward. But you might want to preface this with, I'm going to go ahead and talk about some more sensitive topics here. Just know that everything that we discuss will be kept confidential. Is it all right if I proceed? Yes. Okay, let's go. So that's what you want to establish here. You also want to talk about fertility and about contraception in this area. So you could ask, do you use any contraception? And then you can decide, kind of get a little more about that. OCP, oral contraceptive pills, IUD, intrauterine device, and any type of implants like the kind that they use for contraception. Fertility problems are going to be, maybe if you notice in the gravidas and the paras that they've been pregnant a lot but don't have a lot of living children, you could ask about, have you ever been worked up for any type of fertility problems or things like that. And then if they had pregnancies, did they have any complications? You could also ask them if they were natural deliveries or C-sections. It really just depends how pertinent this is and how much you need to gather about their past medical history. For males, it's a little different. It's a little tricky to ask. I don't always ask this of men unless that's really what they're there for. But I mean, you can ask them, do you have any biological children? If so, they say yes. Have you ever had any trouble with fertility or any type of erectile dysfunction or low testosterone levels? Just make it matter of fact. And then I don't always ask all of these questions to everyone in the past medical history. You really just pick and choose. But we're talking about your practical. Your practical, you do have to ask all of this. The whys for me are youth illnesses. So that's going to be, it's a little tricky. Did you have any illnesses as a child? This would include like chicken pox or mononucleosis, anything like that, any chronic infections, ear infections. You could ask about that. But don't get too crazy on this. For your practical, just make it simple. You have any illnesses as a child? Yearly exams are like maintenance stuff. So, do they get their routine physical every year? Do they get their TB test, their pap smear, their breast exam, their colonoscopy? It just depends. How old are they when they're presenting? What kind of screening exams have they had before? So, you're just making sure that for their age group and their chronic medical conditions that you are covering those. For the practical, just keep it simple. Just ask them, have you had your yearly exam? And the way I like to kind of couple this is like, have you had your yearly exam and yearly immunizations? Have you had your annual physical? Have you had your annual pap smear? That kind of stuff. Immunizations are pretty easy. I ask this of everyone, especially children. Are you up to date on your immunizations, including flu and COVID? So those are things you could ask. Also, like if they're there for a laceration, for instance, you don't want to ask them about their tetanus vaccine. So that's the last thing, immunizations. So I know a medical history doesn't really work with the immunizations eye, but you could, I guess, consider it the eye that goes along with illnesses in this eye and then just fill it in at the end. That's what I like to do. I mean, whatever makes it easier for you. I'm just telling you, this is the order that I find works best. Now, in an emergency room setting, I really only ask the very pertinent things. So, depending on the chief complaint, that's what I ask. Always ask allergies to medications. I always ask medical illnesses. I always ask medications. And then from there, I ask immunizations. Sometimes I ask about prior hospitalizations, prior surgeries. And then sometimes I ask about all the other ones, right? Depending on the chief complaint, but it's not always. Okay. You really have to gain some experience to know what's important. And that's why for now, in your practical, we're just going to ask them all. Okay. We're just getting in the habit of remembering to ask all of these things. Okay. So once we're done asking all these questions, patients might forget to mention important things if you don't prompt them to ask, if you don't prompt them to answer those things. So like you have to ask the right questions to get the right responses from some patients. Remember that you have access to their medical record. Use it to help kind of confirm the information that they've relayed to you. So that is my kind of, I like to say, 3 cents on the past medical history, my cheat sheet and my approach to it. You might have your own, and that's totally fine. Just make sure that for your practical, for your patient encounter practical, that you get all of these things. Because if you look at your checklist, which we will go over, by the way, I'll do a quick video on that as well. You want to make sure that you are tackling every single one so you get that checkbox. Okay. Now, one tip, this is the last tip and I will let you go, is for the history of present illness in your practical, you're going to have to repeat those things, right? You're going to have to say them back when you do your summary at the end of that section, right? You're going to summarize everything back to the patient. As far as past medical history, there is not really a section where you have to summarize this back to your patient. So, one hack that I like to do in a practical situation is just check it off on your cheat sheet for now. Just check it off. I did trauma, I did travel, I did reproductive history. I don't get crazy writing down every detail that your simulated patient tells you, because you're just trying to get through it at this point. Okay. Now, later, you might get in the habit of writing some little notes, and I do still write notes when I see patients. But for now, we're just trying to survive. We're just trying to survive my practical. So you might get just boom, I did it. Boom, I did it for now. Okay. That's just, a little trick that you might try. Okay. So that being said, I hope this video was helpful and not too long and not too boring. But if you have any questions about anything that I've covered, any clarifications you need, be sure to comment below. And I hope you like this. Next up, we're going to be doing the family history, which I think will be really, really quick. And then to round it out, we'll do a review of systems and social history. And then I want to do a quick recap of the rubric that we have for y'all. And then last but not least, a quick demo of the entire thing. So stay tuned for my next video, and I hope you have a great day. See you later.